Hello, everyone. On behalf of King County and the Wilson Sheehan Lab for Economic Opportunities at Notre Dame, I want to give you a big welcome to our Evidence Matters series. I can see the names of everyone who has joined, and it's great to see so many friends and colleagues here with us. Particularly want to give a shout out to our friends from Results for America who helped to promote this event. We're recording this webinar and plan to air it at a later date on King County Television. So I also want to welcome everybody who is tuning in to watch via that channel. I'm Carrie Chihawk. I am King County's Evidence and Impact Officer, and I am really passionate about advancing racial equity through bringing together the expertise of our staff, our research partners, and most importantly, our community. And Leo and King County started this Evidence Matters series for three purposes. First, we want to share the knowledge that we're building from our learning partnerships so we can use that knowledge to advance better and more equitable outcomes in our communities. Second, we want to celebrate the successes from our work and also share our challenges. And third, we want to build the connection with all of you tuning in from all around the country and learn from you and one another. Today, you're going to hear me talk a lot about Leo throughout the conversation. And it is my astrological sign, but that's not what I'm referring to. And I'm not referring to a particular person. Leo stands for Notre Dame's Lab for Economic Opportunities and their academic affiliates who work at universities across the country. And Leo and King County have been working together on several learning projects for the last really several years now. And today we're going to be sharing results from the work that Leo and King County have done together to understand how affordable access to public transit contributes to well being for people with low incomes. King County Metro Transit is one of the largest transit agencies in the United States, and we have a really strong focus on working with the communities we serve to expand equitable access to transit, and particularly for communities who rely on transit to get around. One thing that became very clear during the pandemic is that all of us, every single one of us, is transit dependent because we all rely on the essential workers who rely on transit. And that's something that Tamika Butler has written about very eloquently. King County Metro takes an income-based approach to transit fares, and Metro was one of the first large transit agencies in the US to provide reduced or free fare transit programs at scale for people with low incomes. This income based approach allows us to expand access to transit for the people who most need it and support a sustainable system. You probably recognize that it's really expensive to live here in the Puget Sound region. So, in our income based approach to fares, we are focused on people who earn 200% or below the federal poverty level. And just to give you a perspective, in case you don't know what that number is right off the top of your head, for a family of three, we're talking about families who earn less than $50,000 a year. So, for our event today, we have four great partners who will talk about Metro's income based fare programs and what we're learning about their impact for people with low incomes. And we're going to reserve time at the end of our event to take your questions. So, if you're joining the webinar live, at the bottom of your screen, you'll see the chat, and you can type your questions in there at any time during the webinar and I'll direct your questions to the panel at the end of our conversation. So let me introduce the four people we have who are coming from four different organizations and have been working as a really marvelous team together over the last few years to figure out how we can best expand opportunity through transit. So first of all, we have Maria Jimenez Zepeda. Maria is a leader in King County's reduced fare programs, and Maria helps to design and improve affordable access to transit in the King County region. Next, we have Truong Hoang, who is with Washington State's Department of Social and Health Services. He's the Deputy Regional Administrator for the Community Service Division, and Truong oversees all of the community service offices in King County where people come to access the benefits that they deserve. And then we have David Phillips, who's a research professor at the Lab for Economic Opportunities at Notre Dame, and Matt Freedman, a professor at the University of California at Irvine. David and Matt are both economists and have been working with Metro to study the impact of our reduced fare programs for people with low incomes. In addition to calling out Results for America, who helped us promote this event, I also want to acknowledge, it takes a village to do this work. It also takes funding. So we have some funding support from the University of Wisconsin's Institute for Research on Poverty, the National Bureau of Economic Research, and Evidence for Action, a program at the Robert Wood Johnson Foundation for work that's related to what we're going to talk about today. And our very most important acknowledgement has to go to the many, many people in our community who have helped us to develop Metro's income based approach to fares and who are helping us to learn how these programs have shaped their lives. So thank you. Thank you for all of you who are participating in our work. So let's start a conversation with our panel and let's set the stage by really focusing around, kind of what the context is for people with low incomes in King County. So, Trong, let's start with you. Thousands of people are coming through Washington State's community services offices. Many, I would expect the vast majority of folks are people with low incomes and people from vulnerable populations. What are you hearing from them directly about the challenges that they face getting around the region, and how is transportation impacting their lives?
Hey, Carrie. It's great to be here. So, Washington State is not an easy place to have a car or, commute for those of us that live in the area. We have some of the highest gas prices in the nation, as well as, we have, lots of lakes and waterways and hills and mountains. While, it makes for a really beautiful place to live, it makes transportation really, really complicated. Those with low income and vulnerable populations, they're especially sensitive to rising gas prices as their budget usually doesn't leave a whole lot of wiggle room for them. So, they're sometimes having to choose their priority and prioritize which commutes to go to. So they sometimes have to choose between, going to medical appointments, going to a job search or a job interview, even small things that we might take for granted, like going to the grocery store or visiting with friends and family. They're not necessarily able to go to all of these places. They might not be able to also go to the places where they have to apply for benefits. During the pandemic, we were able to have more services virtually, but we also know that those populations may not have cell phones, they might not have cell phone minutes, they might not have computer access to access all of those virtual services. So, you know, transportation as a barrier not only just impacts, their access to benefits, but it impacts really their daily lives, their physical health, their mental health, their ability to care for others, having to go and care for somebody who might a grandparent or something that lives across town or something, and then also just caring for themselves.
Yeah, thanks, Trong. It's a good reminder. I think people think about King County as a really, connected community, but we have really large pockets and populations who don't have internet access. People need to get around, and those are some really difficult choices. So, Maria, let me also turn to you. I know that Metro Transit gathers a lot of input from communities in King County, both from people who do ride transit as well as from non riders. What do you hear from Metro's customers and others about cost as a barrier to their ability to get around?
Yeah, thanks, Gary, for that question. I'll start by saying that it depends on kind of really the full range of where they stand in terms of income. That even within people with low incomes, you mentioned that threshold is 200% of the federal poverty level. some of the customers we're serving may be closer or even at that 0% of the federal poverty level. And so for people who have low incomes but are maybe towards that higher end of that income threshold, our standard fares may be the ones that are affordable, but programs like Orca Lyft make it so that they can actually use transit and be able to access our mobility. However, for people with very low or no incomes, we have often heard that even that reduced fare is unaffordable. From some of the work that we've done with this population, a little under half reported that in order to ride, they paid what they could in cash or chose not to ride. And many actually indicated that they were unable to pay for transit. And when they were unable to pay, they did just choose not to ride due to fear of negative interactions with bus drivers.
Yeah, yeah, that's really important. And it's great that Metro is using that community input and data to expand access. And since we are going to be broadcasting this on KCTV, I think it's a great opportunity to just give, folks here in our region a moment. Can you describe Metro's income-based fare programs? And where can people go to get more information and to get help signing up if they qualify?
Yes. And I think there's a slide coming up. So here's information about our two main income-based fare programs. First, we have Orca Lyft, which provides a reduced fare from Orca Lyft launched in 2015 and reduces the fare from 275 to currently on a dollar on most transit services. People automatically qualify and if they're enrolled in SNAP, Supplemental Nutrition Assistance Program, or EBT, APA Health, which is Washington's Medicaid, or WIC. And people can actually also apply on their own if their household income is at or below 200% of the federal poverty level, and if they can provide that documentation. One thing that's really great about SNAP and EBT is that if they're getting those services already through DSHS, that means they can enroll in Orca Lyft at that time. But people can also enroll by calling the number shown on the screen below or visiting reducedfare@kingcounty.gov or in person at select locations. And you can see more on our website, kingcounty.gov/orcalift. What's really exciting is that in 2020, we launched a subsidized annual pass, which actually provides no cost transit on King County Metro, Sound Transit, and as of this month, even Everett Transit services as well. This is for people with an even lower income threshold. So this is people living at or below 80% of the federal poverty level, enrolled in a cash state benefit program such as temporary assistance for needy families, and they must live in King, Pierce, or Snohomish County. They can also apply by calling at that number shown on the screen, visiting Reduce Fare at kingcounty.gov, or going to select locations. They can also enroll in if when they're getting those cash benefit programs through DSHS. And you can visit kingcounty.gov/subsidize annual pass for more information.
Great. Thanks, Maria. I'm glad we had an opportunity to share a little bit about those programs. So now that we've heard a little bit about how transportation is impacting people's lives and how Metro's income-based fare programs are set up to help address that, let's turn to the work that Metro's doing with Leo and what motivated that. So, Maria, can you talk a little bit about why Metro was interested in working with Leo researchers? What did you and decision makers at Metro really want to learn more about?
Yeah, so one of the things that was interesting is that we were getting multiple requests from a lot of community agencies saying, "Can you do a program for this population? Can you do a program for this population?" And what we realized was that trying to do so all in one-off basis was maybe not sustainable, but that the under commonality between all of these groups was that they were all people with low incomes. And we knew that, for example, Org Lyft was making a difference in people's lives, but there was still a lot that we didn't know and that we wanted to be able to better evaluate. As you see on the slide here, our theory of change is that by addressing cost and non-cost barriers, we can improve people's mobility, which could then in turn lead to increased access to jobs, housing, education, and services. We then believe that in the long term, this would result in increased health and well-being. And the learnings from this type of evaluation would be really crucial and would be able to inform how Metro invests its resources and how to make sure that we are meeting our goal of investing where needs are greatest.
Yeah, great. And I see like a lot of those things in that those midterm outcomes are what King County calls our determinants of equity. Things like employment, housing, job training, all those things that people need to really fulfill their potential. So that's awesome. So, Trong, I'm going to turn back to you. You have a very busy job serving the state's own clients. And some people might think it's kind of unusual to see a leader from another level of government, from a human service agency, interested in working on a transportation project. Tell us a little bit about what has motivated you to collaborate with King County and other partners on this project to learn about transportation access. What did you hope that our work together would answer for you?
So I'm kind of, I went to school with a degree in psychology and sociology and kind of want to be economist. So I have a lot of, research sort of background that I like to use in my work. But mobility is just such an important part of everyone's lives. We all felt the effects of that when we were all in lockdown for several weeks at the beginning of the pandemic. We couldn't go anywhere. And so transportation mobility is really tied into everything that we do here at the Department of Social and Health Services, the work that we're doing with clients. It's not traditionally thought of as one of the like four pillars of basic needs like shelter, food, health, and employment. But really, mobility plays into all of that. You can't get healthy if you can't go to your medical appointments. You can't get food if you can't go to the grocery store. You can't, be healthy and deal with your mental health issues if you aren't able to go and talk to friends and family. The more we can really do and learn about our clients' behavior, the better we're able to develop services and policies that really help benefit them and also create, greater access for them. I wanted to know how much clients really depend upon transportation for their access for employment and health. And, if providing lower free transit access would help increase some of those outcomes in those areas as well, because our mission in DSHS is to transform lives. And I think transportation is a very important part of that.
Yeah, that's great. And ultimately, we're all serving the same people, right? And the connection we've had with the Department of Social and Health Services has been, I think, really incredible in just getting more access for everybody who's coming into your office onto our transportation programs. It's made it really efficient for us. So I really so appreciate your partnership. And I think we can make you an honorary economist. So
Like,
so let's actually turn to one of our official economists, David Phillips at Leo. I want to bring your perspective into this conversation. And first, could you just tell everybody a little bit about Leo and what Leo's mission is?
Sure. Thanks, Carrie. Yeah, so I'm at the Wilson Stream Lab for Economic Opportunities at the University of Notre Dame. And what we really believe in is partnership, right? That if academic researchers and service providers, both in government and nonprofit organizations and policymakers, can all work together, they can play a critical role in responding to poverty. And so, what we do is we match together researchers, leaders in social service world and local government to conduct evaluations that are trying to measure what's the impact of innovative, effective, scalable programs that could help move people permanently out of poverty. And so that really the key to that vision is this sort of partnership of the sorts of voices that we've been hearing from so far, right? Of working together as a group of people who are committed to do the best that they can to help provide opportunity in their communities.
Yeah, that's great. And I was just out at your 10th anniversary event. There were so many amazing service providers there and policymakers, other, all of your Leo affiliates at universities across the country, like Matt. And I was really proud of the partnership and to be part of that group. So thank you.
Yeah.
So, following up on that, David, you and Matt are both economists. You've collaborated on a really wide range of work together. So tell us a little bit about what interested the two of you in this project, looking at the impact of removing cost as a barrier to transportation mobility in King County.
Yeah, I think, I mean, first, when you interact with individual people, I mean, transportation just comes up repeatedly. I mean, for
Yeah.
me, I got on this direction of doing research related to transportation many years ago, living in the other Washington, D.C., working around a nonprofit employment agency and meeting a man who had walked several miles in the rain just to get help making a resume because he needed to have a job, but he didn't have bus fare, right? And so, I mean, there's just so many instances of that that show up just in daily life. But then I think you sort of zoom out to that and the world that we live in, right? Obviously, we have some neighborhoods where there's greater access to opportunity, and there's others where there's less access to opportunity. And right, policymakers think a lot about how do we respond to that? Are there ways that we can use housing policy to help people who would like to move to a different neighborhood? Are there ways that we can invest in neighborhoods that have been underinvested in? And a lot of times those policies are there's a lot of conversation around them, but it's also very difficult sometimes to make progress. I think one neat thing about transit is it's a system that's already been built. And something uh, uh,
Mm.
like fares is saying, okay, are there ways that we could use this existing system that we've already built? Are there ways that we could adjust it that would provide people with greater access to opportunity that could deal with these huge challenges in a way that might be feasible? And so I think that's some of what attracted an economist like me to work with Metro on a project like this.
Yeah. So thinking about transportation is kind of the flip side of the housing coin,
Yeah.
right? And yeah, in King County, I know, if you look at zip codes in King County, we have, more than 10 years difference in life expectancy, which is really not acceptable. So we want to figure out how we change that. All right. So we've heard a little bit about, what was motivating people to work on this study that we're going to talk about together. So let's dive in a little bit further to talk more specifically about the study and what we've learned from it so far. And David, I'll continue a little bit of the conversation with you. So, obviously King County, state of Washington, our partners like Sound Transit, we want to clearly understand how Metro's income-based fare programs impact people's lives. Those outcomes that Maria was talking about in the theory of change, things like how does fare-free transit for people with low incomes affect employment, their ability to access services, overall health and well-being. But those are really big outcomes, right? Like those are outcomes that are affected by so many different things, not just access to transit. So, talk to us a little bit about how you set up a study so that we can really understand just the contribution of the fare free and reduced fare transit programs on those big outcomes that people care about.
Yeah, that's exactly right. I mean, there's so much going on in people's lives and the complexity of their lives to try to understand, okay, what going on here is just due to fares and access to transit. Like how much does that matter is difficult to parse out. So what we have to do is we have to be able to answer a what if question. We have to be able to say, okay, not just what happens to folks in their lives, what do their lives look like when they have access to a fully subsidized transit pass, but what would have happened to them if they didn't have access to that? And be able to try to measure both of those things. So the way that we do that is we look at two groups of people, right? We can't see that what if for any individual person because they only live one
Hmm.
life. But
Right.
for two different groups of people, we can see what happens to one group of folks and we can see what happens to another group of folks. And if they receive different services, one of them receives access to fully subsidized transit and one does not, one receives the status quo, then we can get a sense of the effect of transit as long as those two groups of people are similar. As long as those other things going on in their lives, in the world around them, in their social environment, as long as those things are similar between those two groups, then we can compare those two groups and get a sense. Okay, here's what access to transit is providing for these folks.
Yeah. Yeah. So, for example, like you could imagine if we're just looking at the group of people who have signed up for transit, we might expect that that group of people, they would naturally benefit more because they're so interested in it, right? So, how are you really making sure that the two groups of people we're looking at are comparable?
Yeah, so in a study like this, what we do is, I mean, you can think about it as sort of drawing names out of a hat or something like that. You say, okay, we've got a limited amount of resources to be able to provide these fully subsidized passes to folks. And we want to do it in a fair way. And so one fair way to provide that is sort of, draw some folks' names out of the hat and offer them this assistance. What you end up then is with two groups of people, right? If these two groups are sort of chosen by lottery, not because one group likes transit more or what, not because I like some group of people better or whatever, not for any particular reason, but chose and sort of drawing names out of a hat. Then you get two groups of people who are similar, right? They would have, if you had them all write down their ages on a piece of paper, right, you'd end up with two groups that have similar average age. They'd have be similar in terms of where they live in the county on average. They'd be similar in terms of different barriers and advantages that they might have in their lives because of the fact that they're not chosen precisely because they're particularly interested in transit, but just by because they were chosen to be sort of comparable groups that are similar on these dimensions.
Yeah, so that's what, we mean by a randomized controlled trial, right? Yeah, so
That's
we're real yeah, go ahead.
Yeah, that's exactly right. So if you hear me say things like randomized control trial or RCT, they're referring to that sort of process that's used in lots of different research to try to get comparable groups of people who end up being similar because of a random draw.
Right, yeah, okay, great. And that helps us to really isolate the impact of just that transit program on the kinds of outcomes that we're looking at. That's great. Okay. So, I'm gonna ask you to describe the study a little bit more. So who participated? How did people get selected? How many people were involved? Talk a little bit about those questions.
Yeah, so there were 1,797 people who participated in the study. And the way that they came into this project was that we offered them the opportunity to participate as they were coming through uh, state community service offices. So we heard from Trung
That's
before,
great. Yeah.
right? Exactly. Who talked about his work with Washington State DSHS, right? And it was the community service offices that he manages and the wonderful staff there that were the ones who were involved in inviting people to be involved in the study. So everybody who's coming through those offices are folks who have low income, and so they're a good fit for a project like this. And they were asked already, but prior to the research study, were being asked if they had interest in receiving public transit, the Orca Lift program that Maria talked about before. And so what we sort of layered into that existing process was to say, oh, what if we gave people an opportunity to participate in this study? And if they got in the study, they'd have a chance to enter this drawing to see if they would get a sort of deeper subsidy for riding transit. And so lots of people said yes to that opportunity, and the people who said yes to that opportunity to participate in the study are the ones. That's the 1,797 people who ended up in, in the study that we worked together to conduct.
That's great. And so one part of that group of people were enrolled in our reduced fare Orca Lift program, and then the other group of people were given what were they given?
Yeah, and so they got a transit pass that is sort of piloted for just for the purposes of this study. So it's not a formal program like some of the ones that Bria talked about before. But yeah, it was
Mhm.
a particular pass that still worked with an Orca card, but it was an Orca card that was set up to provide about 4 months of fully subsidized transit. So they could take unlimited rides without paying a fare. Metro would pay the fare for riding different forms of transit around the area. So the bus and the light rail and so on. And so, yeah, compared to the status quo getting the Orca Lift program, right, it's reducing their fare considerably and allowing them to ride for free for about 4 months.
Yeah. And this all happened before Metro actually launched what's now our fully subsidized pass program, right? When did this study occur?
That's exactly right. So this study occurred. People joined the study in 2019 and then early 2020. So it happened for some folks. It was a little while before COVID. And some folks joined the study right before COVID happened.
Great. Yeah. And I see some questions coming in through the chat, including a question about COVID impact. So we might get to that a little bit later. But if you do have questions, I encourage you to put them in the chat. We definitely want to hear your questions, and we have time reserved at the end to get to your answers. So thanks for talking about the setup of the study, David, and having that kind of work lead into Metro's launch of the subsidized annual pass. We learned a lot just from the process of setting it up and kind of what we were seeing before you and Matt did a lot of your analysis of the results. So let's actually turn to looking at some of those results. Very exciting. Feel like there should be a big reveal. Smoke coming up behind me, something like that.
Drum roll.
So, Matt, I'm going to turn to you to talk a little bit about what we are learning from the study. So, you and David have had a chance to work with a lot of the data, and they cover a really wide range of outcomes. And you're looking at what was different in the data for the group of people who had a fare free transit card and the group of people who were enrolled in Orca Lift or our reduced fare program. So let's walk through what that study showed for each of the kind of links that we saw in that theory of change. So the first thing we would expect to see is that, you know, people with a fare free card might use transit more. Is that what happened? What did you find out?
Absolutely, yes. So using data that from Metro as well as follow-up surveys from individuals who were participating in the study, we saw immediate and fairly large increases in transit use among those who had access to free fares. So in particular, we found that the group of people who with low incomes who got the fare-free cards roughly doubled their use of transit relative to
Double.
those who were on Orca Lyft.
Wow. So going from just a reduced fare to the fully subsidized fare was doubling their use of transit. That's
That's
amazing.
correct, in terms of number of boardings on transit, mostly buses, of course, in King
Yeah.
County.
And was that true for everybody who participated, or were there like, sometimes there are differences by demographic groups like gender, race, where people live, that kind of thing?
Yeah, that's a great question. In fact, the increases that we saw were pretty broad-based, so, they were fairly similar sized impacts on transit use among people in different demographic groups.
Hmm.
And what's more, it wasn't kind of just a short run, just in the first week or 2 of when they had access to free fares. It was quite persistent, increases in transit use during the duration of the subsidy, so when they were actually had access to free fares.
Oh, that's great. Yeah. And I know at Metro, we put a lot of work into making sure we're getting out into those communities who most need it. So it's great to see that that's actually kind of coming to fruition. So, how about in terms of like what people used transit for? Do we have any information about that?
Yeah, I think one of the most striking things to come out of our work was in fact the wide range of things that people were using
Hmm.
transit for. So as I alluded, we conducted follow-up surveys with individuals in the study, and in fact, it revealed sort of a variety of different uses of free transit, ranging from using the free transit to run errands, to visit and assist family and friends, access healthcare and other city services, to get to and from work, to participate in community and religious events, a wide array of different activities. And so, I think it just highlights kind of that again, coming back to things Truong was talking about. There's kind of barriers to participating in lots of things that, in terms of transportation, it seemed like free transit freed up people to do a lot of different activities.
Yeah, that's great. Really kind of getting at all of that stuff in those midterm outcomes.
That's
That's
right.
cool. And then, I also know that even since COVID, even though transit ridership has fallen, some of our bus routes at certain times of day can get kind of crowded. So that I think that was one big concern we had with thinking about moving to, the subsidized annual pass program. What kind of impact is that going to have on the crowding of our system? Did you find out anything about that?
Yeah, that's a great question. So we could track using data from Metro the times that people were taking transit and the routes that they took as well. And so we found that the individuals with low incomes in a study that had access to free fares took a disproportionate number of the additional trips at off-peak hours and on buses that weren't already crowded, buses and routes that weren't already crowded. So on the whole, at least for kind of the scale of the subsidy that we were looking at in this study, there were very limited implications for congestion along the bus system itself.
Right. And so let's talk about some of those other outcomes. People obviously aren't just using transit because they want to ride the bus. Some people do. But how did having a fare free transit card really impact people's lives? What changed about their overall well-being?
Yeah, that's great. We were really fortunate in the study. We were able to access a wide variety of data that was already being collected by the county and state, as well as again using follow-up surveys of individuals to kind of investigate some of these different outcomes. So we didn't detect large changes in paid hours worked or employment, at least using the administrative data that we had access to from the state. But we did see that access to free transit was associated with some indications of improved health. Also, using credit data, we were able to see some modest improvements in financial security among those with access to free transit relative to those who were on Orca-Lyft and did not have access to free transit. When we ask people directly about their well-being along different dimensions in follow-up surveys, we also found that free transit was associated with better self-reported well-being along a number of different dimensions, right? Including not only transportation, which we would expect, but also financial well-being, health well-being, and even employment
Wow.
well-being as well. And so this is consistent kind of with to a large extent with what we were able to observe in the administrative data and kind of more generally with the varied uses of transit that people reported.
Yeah. That's really interesting though, because you were saying you didn't really detect a big effect on the measures of employment in the state data, like hours worked or income. But people were reporting like their credit scores went up, which is amazing because, we may not agree with, how credit scores work, but they do impact so many aspects of our lives. And it sounds like people were also reporting that their employment situation was better. So, like, how do you reconcile that? What do you think's going on there?
Yeah, that's a great question and something that we kind of thought about a lot. So, based on our results, it may be the case, right, that transit really facilitates more trips for things like errands, visiting family, and so on. But maybe at least the temporary access to free transit for this population may not have been enough to kind of move the needle on employment outcomes.
Mm,
That being said, though, right, the administrative data on employment that the state collects and that we were able to link to individuals in the study just consists of jobs where people pay payroll taxes and kind of give us very limited information about the
mhm,
jobs themselves. And so, we don't see much movement, right, in these sort of administratively measured employment outcomes. But as you mentioned, right, people do self-report improvements in employment well-being when they have access to free transit. So it may just be that we're not able to detect some of the more subtle changes that are happening with people's employment situations with this administrative data. I think this also kind of highlights the value of this sort of more multi-pronged approach to looking at outcomes using data, not only that stuff that's collected already by the state for administrative reasons, but also asking people more directly in a kind of qualitative way what has changed in their lives. And I think the kind of combined evidence here can be really helpful in just sort of understanding what's happening and people's responses to brief news.
yeah, that's great. And I guess also, I'm just thinking like the study was giving people a fare free transit card that was for about 4 months, maybe, right? So probably not really, it takes a long time to like think about finding a new job, right?
Yeah,
So
exactly. And
um,
so I think, this new subsidized pass program that Maria was referring to is giving people access to free fares for a period of time. And so we may expect to see somewhat different impacts on some of these kind of medium and longer run outcomes that we care about.
yeah, and it's really exciting that the team is working together on evaluating that program too. So we'll have another one of these in a year to talk about what we've learned from that evaluation too. So thanks so much for that, Matt.
Yeah, absolutely.
So great to hear about some of the amazing results of our study looking at providing people with fare free transit. So twice as much use of transit, increase in people's credit scores, lots of markers of increases in people's health and well-being. It's really pretty remarkable. It's amazing to see what we're learning about that and how it impacts the lives of people with low incomes. And those results are most meaningful when we as, public sector decision makers really put those results to use. So let's talk a little bit about that and what's coming next. So Trong, I want to turn back to you and your perspective from the state's human services role. How do you see these results and this work influencing the way the state thinks about human services and helping to meet people's needs, particularly people with low incomes? What do you see might change as a result of this work at the state level?
So, I mean, this work not only, informs the state to change some of its policies on providing, greater support services, but also, helping policymakers and the legislature provide more funding and seeing transportation mobility as one of those essential pillars to self-sufficiency that I was talking about. Already we're, exploring additional funding to other programs. Traditionally we have only had support services that provides bus tickets or transportation needs for clients that were on the temporary assistance for needy families, so the TANF program. We're shifting to also looking at clients on other programs, being able to give them similar support services for low fare, or no fare costs for them for transportation, because we're seeing just like some of those, impacts that, we were seeing with the credit score and the health, those things now we can show to those policymakers to say transportation is that important, and here's the evidence that says it's working, and so they're more apt to provide us funding for that because here in Washington we have limited resources, and so we want to make sure that we're using those resources as responsibly as we can.
Yeah, so it's really, showing how transportation might be improving the outcomes that you care about for people and also kind of making the way you provide services more efficient. People can get to their services and all of those kinds of things. That's great. So Maria, let me turn to you as well. What about at Metro? How are decision makers like you and others using these results at Metro?
Yeah, I think I want to start by mentioning that, like, maybe historically, Metro was more of a transportation agency, thinking about how to get people from point A to point B. But in more recent history, has been thinking about what does it mean to be a mobility agency and how do we support people's mobility. King County Metro believes that mobility is a human right and that the ability to pay fare should not be a barrier to using transit, and as such, takes an income based approach to fares. What this means is that those who can pay a full fare are asked to do so, whether that fare is paid by themselves or by their employers. For those with lower incomes, we then provide a low or no cost option to be able to ride transit. And I think the results from this research really has only strengthened that income-based approach to fares of providing no cost transit based on income, especially the most lowest income and most vulnerable populations. As was mentioned earlier, these results also then in this research came before the subsidized annual pass. So the learnings that we had from this really informed the creation of the subsidized annual pass, what we could expect, what are the benefits that we could receive. And we're continuing to use the learnings from this study and other research that we're doing to be able to inform how do we make this work more sustainable? How do we make it, longer lasting? And, how do we make sure that we are fulfilling our goal of investing where needs are greatest?
That's great, Maria. I love Metro's focus on mobility as a human right. And I can see how it's shifting the work of the agency. So, the study has really amazing results, along many dimensions. And I know that there are people here in our region, as well as, conversation happening around the US who are advocating that transit systems just get rid of fares for everybody. How do how do you think about that? What's Metro's response to that?
Yeah, first is cost barrier is only one of the barriers to people using transit. And I think, I'm not sure if it was mentioned or not, but one of the things that we did find in the study is that reducing the cost barrier really increases access to transit and mobility, but only if there's a
Mhm.
transit stop near them.
Oh, sure.
Um, so Metro is prioritizing where needs are greatest and trying to provide an all-day regional network of frequent transit services. What that means is that we need to be thoughtful about striking the right balance between providing affordable transportation and making sure that we have a sustainable system that prioritizes other things that are also really important to everyone. speed, safety, and a system that actually can move people from where they need to go. Currently, fares help Metro and the region maintain the level of service that we have, and are also important if we want to continue to grow our services and make it possible for people to have even more mobility. Without an alternative source of revenue, going fare free at this moment would likely mean cuts to our services. That would
Mm,
likely impact those with low incomes and vulnerable populations that actually rely on our transit services the most.
yeah. So it's trying to find that balance of, bringing in revenue through fares, providing access to people who can't afford to pay a fare, but then investing in a system as well that really provides all the other attributes that people need to get around, like extensiveness of the system, safety, reliability, all of those kinds of things. Does that sound right?
Yes, yes, correct.
Great. Well, that's great. Thanks, Maria. So, David and Matt, I want to bring you back into the conversation too, in terms of how these results are being put to use. What are you hearing from other places in the U.S.? Are you seeing other transit systems and jurisdictions interested in the results of our work here? Do they translate?
Yes, I mean, there's definitely been a lot of interest. I think right, first of all, like, right, lots of different places and transit agencies are wrestling with these same questions, right? They're wrestling with whether to have a traditional fare structure that's flat fare, right? Whether to have an income-based fare structure, right? Some places have been moving toward, like I'm sitting in Washington D.C. right now, which is moving toward free fares on the bus, not on the train, but on the bus. And yeah, I think a lot of these places have similar questions about what happens when some or all riders are not paying for the buses or the train. And so I think that what we've been able to do in Seattle, in King County with Metro, to be able to have a sort of clear measure of impact through doing the randomized control trial and through being able to pull together through partnership with the county and with the state all of these different forms of information on how this affects people's lives in different ways. I think it's really informative to these other jurisdictions. So like I'm in Washington D.C. right now. I'm going to be presenting to folks here locally because they're interested in learning from what the ways that Metro and others in King County have been innovating and the ways that it can help guide them as they're thinking about their own systems.
That's great. Matt, do you want to add anything?
No, just to echo David, I think that there's an incredible interest around the country in exploring kind of not just, of course, fair policy, but also some of these other trade-offs that you're referring to, Carrie, about whether we
Yeah,
devote resources to reducing fares versus changing, sort of access, right, routes. And so these are kind of really important questions. And our hope, of course, is that if we can kind of provide information, even if it's only on, one dimension of this, it can help inform these broader policy discussions that again are so
yeah,
relevant today for many transit systems.
yeah. And I do know we have some of our partners from Results for America with us here today, and they've actually done a case study that's featured in their economic mobility catalog on this very study. So if folks want to, check that out, I'd encourage you to do so. It's a great way to get the findings of this work out. So let me, I think one really important thing about any kind of study is to be clear about what we've learned, but also to be really clear about what the limitations of the study are. So, like Matt, your discussion about the employment, that's like kind of a question that was unearthed for us that we need to do more work on. So I'm interested in hearing a little bit from everybody, Maria, Truong, David, and Matt. What's coming next? What are we doing to continue to learn more about how we can serve people with low incomes with transit access? Maria, you want to take a crack at that?
Yeah. As one of my colleagues says, good research only begets more questions. And so now are really just curious about what was it about this fully subsidized transit pass that was making an impact on people's lives? Was it really just cost alone? Or was it that they no longer had to worry about how or where or when to reload their cards, as well as questions about what part of increased transit was really making the difference for it? Was it getting to services? Was it spending time with friends and family? Just like digging deeper on those questions. And so actually we're doing an evaluation project of our subsidizing no pass program. And all of these unanswered questions then are prompting us to do a qualitative component to be able to dig deeper on some of these questions and really get a better understanding more holistically of what why we're seeing the results that we're seeing.
That's great. So I know we've got some questions in the chat, and I'd encourage other folks to put your questions in the chat too. We're going to turn to those pretty shortly here. But before we do that, I'm going to move to maybe kind of a little bit of a rapid fire question that I want each of you to answer. So, one thing I think that's really struck me about this work is that it's a really remarkable team, right? Like, you're four people from four different organizations. The team who's doing this work is even larger than the four of you, working across organizations, across different sectors, levels of government. We're all learning together and learning from the people who we are serving. So that's kind of unusual. And I'd love to hear something about that or about the work in general that's just really kind of stuck with you. And let me, maybe Trong, could I ask you to go first?
Yeah, so I think probably what has struck me the most is the level of listening to each other, really trying to learn and understand from each other's perspective, and taking a step back and just viewing it from a different standpoint. We have our own sort of specialties and things that we look at, but what really struck me is with David and Matt, they really sat there and not only listened to the things that myself and Maria were saying, but really ask probing questions as to getting to the point instead of just going straight towards, you know, their research. Really trying to understand all the different aspects of how clients' behavior is and what they do on a daily basis, I think really helped them to sort of factor those things in and how they structured the research project.
That's great. David, I hope that resonates with you. And what's
Yeah,
your rapid fire answer?
it
What
does. And so
stuck with you?
to me, what sticks with me is just how doing this type of work well really requires like very different forms of expertise that different people have, and you need the whole team to do it. Like I think we tend to have this like big man of science sort of view of these things, where like Notre Dame study says that free fares do such and such, right? And that tends to sort of highlight a particular aspect of this, but it's like we need customer service representatives who know how to communicate with
Yes.
folks who are coming through to be able to enroll them in the study and to do that in a respectful way. We need people who have expertise at Metro who know the right questions to ask about like how is the transit system changing, what policy decisions are coming up, how can this actually be informative, right? We need all of these different voices and different pieces of expertise in the conversation to actually do something that's useful, and that's
Yeah.
been sticking with me.
And most importantly, the expertise in our community, right? And of the people who we're serving directly. Yeah. So Maria, how about you? What's really stuck with you about this work?
One is that definitely just thinking about the scope of learning is a lot bigger than I think would have been if it were just Metro. And also that then we get to share those results with a much wider audience than it would have been if it were just Metro. I think just that perspective of being able to share learnings across the whole country has been really impressive.
That's great. And Matt, you have the last word. What stuck with you about this work?
Well, you stole my thunder because I was gonna say they. I think what stuck with me the most is kind of the one how passionate everybody here is
Mhm.
about this work, and I mean it's hard to not honestly be excited about working on projects with this team because there's so much energy around these policy questions and so much interest. And to be honest, being able to work with this team has made it clear that like work we do is having bigger impacts, and I think that's really important, of course, to us, to Leo, to and hopefully just to the society, the city itself. So that's one, and then I think that again, the ability to kind of visit King County to hear kind of the diverse voices and to participate kind of both qualitatively and on the quantitative side to studying these questions has been just enormously rewarding. And so, and it's been really fantastic to work with this team.
Yeah. Thanks, Matt. I'll say for myself too, I think, there's so much passion around the big policy questions, serving our community really well, but also that marriage of policy questions, the service, equity, and using data and evidence to help us do it all better. It's been great. Okay, well, we do have some questions from the audience that I want to turn to. First one I want to ask you, and I'll have any of you jump in, is there a person you encountered in the course of this study or a story you heard from, someone who is served by Metro's income-based fare programs that really sticks in your mind about the impact of transportation or the impact of fully subsidized transit?
So
Maria, you're unmuted. Let me take Maria and then I'll come back to you, Trong.
I beat you to it, Truong. I had two, but I'll just share one. This is from a subsidizing no pass customers, and I'm just gonna read it. I cried just thinking about how many resources I'm spared with this subsidizing no pass. Money, obviously. Time, knowing I won't have to rely on compassionate drivers if I am short or properly fareless, and running the risk of missing a connection. But especially, it is the dignity of being able to board a bus without fear of being punished or judged because of my economic situation. It really does wear on a body when contemporaries roll their eyes because they don't get that $2 is a big deal. It hurts to know when I'm operating in integrity, but the person I'm talking to questions whether or not I can actually pay the fare.
Wow, that's really powerful, Maria. It's always so great to hear it directly in someone's their own words. And the word that really stuck with me from that was dignity. So that's not something we can measure in administrative data, but is really, really, really important in the delivery of these services. So, Trong, you had something to add. What's a story or someone who's really stuck with you?
I actually just heard about an individual last month. He is on state disability. He has some mental health issues, and he likes to go to beaches and parks in the area, which he says, makes it easier for him to deal with his mental health issues. And, in the past, he had to worry about whether or not he could afford to go to these places. And with, the past, he's able to go to more parks and more beaches and be able to really take care of himself more. When he found out that, he was eligible for the program, he was just ecstatic because he said to the worker that was giving him the card that he now had the ability to go whenever he wanted to, and also he had the ability to go to more places. So he expanded, the coverage area for where he could go to. And he said that just the thought of that alone helped ease his sort of stress of having to like choose from those services that I was talking about. He didn't have to think about it anymore. He could just go do it.
That's great. I love that. Anything come up for you, David and Matt? Because I know you spent a
Trying
lot
to
of time
unmute.
in direct
Yeah.
connect with people.
Yeah, I think to me that the one that comes to mind is being able to sit there right at the beginning of so we were privileged to be able to be there during some of the enrollments where folks were being invited to say, hey, here this is study going on and you might have a chance to have access to this card, that would give you free bus fare for a few months and being able to see people in that moment when it's like they're being told, yeah, you could sign up for this thing and here's the card. And now this person has, they walked in that day with no sense of this. And now they walk out with a card that's going to pay the bus for the next 4 months. And just seeing people's face light up in that moment of you could just see like how much this means to an individual in that place.
That's great. Matt?
Yeah, I felt the same way. There's been no better moment in this work for me than to be actually sitting in a CSO with one of the customer service reps talking to individual clients and sharing the news that they had access to free transit. So, and again, I think the CSO employees themselves are amazing, amazing people, and they do amazing work every day. And they, which, we're also really delighted to be able to share this with customers there. And so to hear their stories about it too was really incredible. So that's been really a huge highlight for me.
Yeah, that's great, Matt. I also, I had the opportunity to actually share some of the results with some of our transit staff, and I will never forget the moment when I told them that, the study was showing that it doubled people's transit use. I mean, the looks on people's faces, right? Like, because our employees are so dedicated, they want to be providing good service, they want to be expanding access to mobility for people. And so this was like an indication, a real data point of the contribution that they were making to that aim. And so it's great to see that too. Okay, I'm going to turn to a couple more questions from the audience. And there were several questions fairly detailed about the impact of COVID on transportation. And maybe I'll just shift the focus of those questions a little bit to focus on the impacts on people with low incomes and on the studies. So, David and Matt, I'll turn to you because I know that you actually did quite a bit of work looking at the impacts of COVID on transportation in King County. Can one of you, talk a little bit about that, and particularly, like, what did you see between, people of higher incomes and people of lower incomes?
Yeah, I'll take it. So so the COVID happened, of course, in, March 2020, and it was in fact kind of towards the end of when we were doing enrollment for this study as well. And so obviously a lot of things changed with COVID, including a lot of big changes within the transit system itself. And so, as many folks in the audience from King County may remember, they kind of suspended fare collection beginning of COVID. There was also some service changes as well that happened. One really, in some ways, fortunate thing was that because we had the study running, we were conducting surveys with individuals who were participating, and we continued to conduct surveys of folks during the pandemic itself. So that shed a lot of light on sort of the types of trips they were taking, if they were taking any at all, and sort of general sort of their situations during COVID. And so we were able to understand a lot about, of course, a very large general reduction in COVID, during COVID in travel itself, and a particularly large reduction in transit use during COVID. One thing that was also clear from the work we did, and this was Metro was incredibly helpful at providing additional data that was useful here. We also used some smartphone-based mobility data, is that we could see very clearly, differentials in the extent to which travel declined across different groups. So travel declined disproportionately among folks who were higher income relative to lower income, in part because of course, the extent to which individuals were able to work from home, come up with other accommodations during COVID. So we were able to learn a lot just about travel behavior during COVID itself. And then, of course, we had to sort of think about that in the context of our study too, and sort of can speak more to that. But obviously, dealing with the kind of COVID shock was a big part of the study, and part of the reason, of course, we're continuing with this work now to try to understand some of these medium and longer term outcomes better.
Yeah, and I think that work, Matt, really points to, what I brought up at the beginning, right? Like, some of us were able to really work from home, and so many others of us, and particularly a lot of people with lower incomes, were not. And we are dependent on those folks, right? To do the essential work, healthcare workers, people who are delivering things to us, people who are just keeping things running as much as they could. And so we're all transit dependent in that respect. And I think also we saw, maybe some people were switching from transit to their own vehicles, but there was just a lot of among people with higher incomes just not traveling, right? So really big impacts. We invite everyone to come back to the transit system, back to that community space of the bus where we can be together and enjoy a stress-free commute together. It's something, I'm working from home almost all the time. It's something I really miss is my commute. It was a chance for me to kind of, just have a moment to myself. All right. So, another question I saw in the chat was about trade-offs. So it's great that the research is informing, how we think about transportation, but how do we think about, how do we do research? How do we think about the trade-offs between, different types of interventions like healthcare interventions or housing interventions or transit interventions? Is it a trade-off? How do we think about that? Anybody want to tackle that one?
Maybe
David,
I'll
I
say
saw.
a
Yeah,
little
go
bit of
ahead.
word. Then I'd love to hear folks who are on the policy side. I mean, I think and Bria was speaking to this a little bit before, but talking about how metro system works and thinking about fare subsidies, right? I mean, even within metro, right, within any transit agency, right, there is some question of like, okay, given a certain budget, uh, you know, how much do we spend on providing access in terms of cheaper transit? How much do we spend on access in terms of more frequent or how quality or more extensive transit, right? And so I think there are some real trade-offs there, given a fixed budget. Now, of course, right, more resources allows something to sometimes allows you to get past some of those trade-offs, but I think there are some trade-offs there. I do think one of the things that this study points to, and Matt talked about in the results, is that you might think about transit versus health versus all these things as being different. But I think one thing that we're showing is that they're interconnected, right? That allowing people greater access to transit is providing people with an opportunity to, for instance, improve their health. Like the story that Truong told about the gentleman going to the beaches and parks, right, is a great example of this, right? There might be situations where you might think, oh, we need to invest in healthcare, but sometimes investing in transit is investing in people's health if it's providing people access to the things that they need in order to be healthy. And so I think there are trade-offs.
Yeah.
That's true. I'm an economist. We love talking about trade-offs, right? But it's also the case that these things are interconnected and sometimes they're complementary too.
Yeah, I think there's so much of the both and, right? Like when we look at our equity work in King County and our determinants of equity, you know, you can't take any one of those roots of the tree away. A branch will die off. So it's really, a foundation of lots of different things that people need to be able to fulfill their potential. And so, how do we really focus on where the need is greatest and where we as a public sector agency can help to provide that support for those who are most in need of it? So, trying to trying to think more about the both and maybe and strike that right balance is really really important. Okay, I think last question, and we'll tackle it pretty quickly, but what about the data? What data did you use? How did you get access to it? And importantly, how was people's privacy protected? Because you're looking at individual level data, right? David or Matt, you want to tackle that?
Okay, I'll say a word. The short version is that the most there was some surveying, but most of the data was data that already exists that's created for other purposes, just Metro, the purpose of process of doing business, state agencies, the process of doing business created. Yeah, and so then the question is, okay, when does someone a researcher get access to that, and how do you guide that? I think there's a couple of key points. One is that, right, as I mentioned, I think a while ago, people were given an opportunity to participate in this. Anybody could say no to it, and so if someone didn't want to, we asked people's permission do, is it okay for us to look at this data that already exists? And so that's really important. A second piece of it also is that a lot of the data that we got back, especially including all the data that we got from the state of Washington, from their great research and data analysis group at the SHS, did not include people's identities when we got it. And so they were able to link data up themselves, take people's names and that sort of thing off of it, provide it to us so that we can analyze that data, but without seeing people's identities. And so we put some of these firewalls in place and are careful about data security and so on, so that we can learn the things that we need to learn while also being respectful of people's privacy and giving them a chance to decide not to participate if they don't want to participate in research.
That's great. And I'm going to take the one of the last questions we got, which was, how can I sign up and learn more? So I'll ask Patrick to put up our final slide, which has a website where you can sign up to learn about future Evidence Matters events. I want to give a big thanks to our wonderful team here, who and to all of you who joined us today. I want to thank everybody who may be watching us on KCTV. We're so glad to have your interest. I hope you can make it to the website to sign up to learn more. And most of all, again, I want to thank the people who participated in this study. Metro and our partners are learning so much from you, and we promise that we will put the results to work to serve you better. So thanks, everybody. Thank you for spending part of your day with us, and we look forward to seeing you all again.